coming up. Regretting that tattoo?
I'm actually pretty excited about this.
I love it so far, yes.
So you want people to go get tattoos that you don't like so you can come into you so you can remove them.
Welcome back, everybody. Well, here to tell us about the latest in tattoo removal is plastic surgeon Dr. Zell Krajdan.
Welcome to the show, sir.
Thanks, guys.
Good to see you, as always.
Great seeing you.
You know what? Tattoos obviously have been around for a long time. Very, very hot trend right now. But tattoo removal is becoming a hot trend. People are really doing it a lot more.
Oh, yeah. I mean, the demographic has totally changed. A generation ago, tattoos were sailors, war veterans. Now it's pretty much every 35-year-old mom getting one.
Absolutely.
Yeah, absolutely. So what's the best removal for a tattoo?
In general, it's always been lasers. And lasers is a huge umbrella term. Some of the older style lasers worked well, but you needed 10, 15, 20 treatments.
Really? Wow.
With only about 50% removal. So they worked reasonably well, but there was nothing really magical about them.
So all they could do is just sort of fade it away, but not remove it.
Exactly. It faded them, and with a lot of treatments and a lot of visits for someone.
And would that be a lot of pain for someone, or was it painless?
It's more pain, but it was more the nuisance. You want to go to someone's office 5 times? No problem. You're going 15 times. It really interferes with your schedule.
Too much. And it just ends up looking messier than it did before, I'm sure.
It could in some cases.
Yeah, okay.
Now,
so
you've got a little video of a procedure. What's the name of the procedure first?
It's called PicoSure. It's a new type of laser that we've brought in at SpaMedica in the past 6-7 months.
Okay.
And here's so talk us through what's happening.
Someone's sitting here. If it's a small area, numbing cream, large area, we freeze it.
Okay.
More or less what I'm doing is zapping down the skin. With PicoSure, it uses a billionth of a second photoacoustic wave to break down, almost explode the pigmentation within the dermal layer of the skin.
Now, that looks like it hurts. Does it hurt?
It's really not too bad. Women who've had laser hair removal will describe it as that sensation.
Yeah.
A lot of my male patients, about 30–40%, describe it as an elastic band, a snapping sensation.
Snapping feel. It almost sounds like it looks like it would sound
Uncomfortable, yes. Painful, no.
Okay.
And how many treatments are we looking at to remove?
That's the hugest advantage. You're looking at between 4 and 6 treatments, which compared to the older treatments of 12 and 16, and getting about 70 to 90% removal.
Which is amazing.
Huge difference.
And
definitely.
sometimes you have those dark and intense tattoos that can be very, very effective for you.
So with this technique with PicoSure, works much better for blacks and for greens, and for those funky colors like whites and golds.
Yeah. So let's talk about skin colors. Is it for all skin types?
It can be used for all skin types, but as a caveat, as a physician, I tell people, you know, your type 1 and 2 skin's very white, pasty skin like mine, pretty safe. You get into darker skin tones, Mediterranean skin tones, you do have to be a little bit more careful about who treats you, how they treat you, and the depth of the wavelength.
Now, is it new? Is this like fresh off the market?
PicoSure is new in the past 6 months, yes.
Okay, and in 6 months, have you seen a lot of people come in and start trying this particular style?
In my practice, my patients have been people who've gone elsewhere, they've tried 5–6 treatments, they've wasted a good amount of time, a good amount of money, and it's barely faded.
Wow, and you've got some before and after photos.
We have a few to look at.
Which are pretty awesome.
Okay, so this is...
So what's happening here?
This would be a good example. Here's someone's tattoo, old sailor tattoo, that was my analogy.
So faded, it just, you don't even know what it is.
It's been treated 5–6 times. As you guys mentioned, it's now almost worse. It's kind of blended in.
Right.
Here's it right after the treatment. As it gets this white frosted look.
What's happening there? Why is it getting that white frosted
The best way to describe it is here's the pigmentation, it explodes. The skin flakes off with a bit of a frost, almost like a partial thickness burn, like a little blistering burn.
Right.
And that is after one treatment. You already have some good fading after that one treatment.
Yeah.
The furthest picture on the right here is after 6 treatments.
And this is considered completely gone or 90%?
You know, the photograph, it does look 100% gone. In person, it's 80–90%. But it's faded enough that they can wear their sleeves up. It's not noticeable. If they want, they could re-tattoo something nicer on top of it.
So they can actually a tattoo on top of the removal.
Oh, definitely.
Again, like something if it was hideous or a girlfriend's name that she doesn't like anyway and he's got a new girlfriend.
Sure, I mean, I have one...
Barb is now Sally and he needs to change it to Sally.
Exactly, whatever he like. Or Sal, just shorten it.
Oh,
you know?
Yeah, it could be Sal.
I have one guy on the go now. He has multiple tattoos on his chest, and him and his tattoo artist have come with me with a new plan. I'm fading away some of it, kind of around, and they're going to tattoo around it to make it look a little bit nicer. So you can do things like that to play around.
And this one here, it's literally gone.
This is great. I mean, but this is your perfect patient where it's white skin, one pigment, one color. They came in 3 months after the treatment. They had true tattoo regret, and this is your ideal result. This is your best case scenario.
So why is light skin actually better?
You want a differentiation between your native skin color versus dark tattoo. So white skin, dark tattoo, great.
And this one here, this is a pretty colorful tattoo.
Exactly.
So you're saying colors are pretty good as well.
They can be challenging. There's so many different levels of the skin, and the wavelengths can't attack each skin color exactly and each tattoo pigment exactly. So for the reds, I'm still using the older machines for my reds. I find this PicoSure is great, except for reds. I'll treat someone, all gone, 5 treatments, everyone's happy, but you see these red dots, I bring in the old laser and try and get rid of the reds with that.
And what are the costs for these?
It depends on size. Just like with designing, it's all by square footage. How big is your bathroom? How big is your tattoo? Small area, $300. Large area can go up to $500, $800, depending on how much space we need to do.
Okay, and there's any risks involved, or is it pretty well?
Minor pain, minor bleeding. The next day you can shower, wash your skin, put makeup on it, go right back to work.
Wow.
Okay, so you've done a lot. So you've been doing a lot of these, and you're actually pretty excited about this,
aren't you? I love it so far, yes.
So you want people to go get tattoos that you don't like, so you can come into you, so you can remove them.
Except on your face.
Enjoy it.
Just on your back.
Don't do it on your face.
Not on your face.
Just do it on your butt.
Exactly.
That's right. Well, great to see you. Thanks so much for being
That
here.
is fantastic. So there's some great options if you have a tattoo you don't like.
This is amazing, though. This is going to revolutionize your confidence to go out and do it. Because you're going to know down the road you can get rid of it. So that's awesome. Thank you so much.
Oh, there she is, Brooke Shields. She uses Latisse, and you can get it here at SpaMedica with Dr. Stephen Mulholland. Her birthday's on the same day as mine, Dr. Mulholland.
I think you share gene code.
I think we do. She's a little older than me, though. Maybe a couple of years. She's looking fantastic.
It's very obvious.
Yeah. I'm going to... Thank you. We're going to put on these glasses here. Why are we putting on these glasses right now?
Well, what we're doing is tattoo removal. Tattoo removal has exploded. Think how many young kids you know that have ink all over their body.
Why do they do that?
I don't know, because they're 19, 20, 21.
They don't realize what's coming, and they'll probably want it removed later in life.
One day they're working for city or the federal government. They realize, wow, that doesn't look so good anymore.
Yeah.
So tattoo removal has become incredibly popular. Now, the problem is a lot of them are multicolored and difficult to remove. And so this, for example, if you see the before and afters there,
right here?
Yep,
okay, yeah.
Those are multicolored tattoo removals, yellow, green, red, orange.
They're hard to remove.
In the old days, all we had was black tattoos. Now we have to have new lasers that deal with multiple colors.
And we can do it now.
We can now, hence the Revlite. We're looking here at the Revlite, which is the latest tattoo removal device. It deals with all colors that you could possibly get with a tattoo.
Okay, you know what? I want to talk about Gwen's tattoo, just because I'm interested. Tell me about this tattoo. What is that tattoo you want removed?
That's my husband's initials.
Okay.
But I'm having it removed so that I can...
Because you're not with him anymore?
I am still with him. But I'm going to have it removed.
People have to get that done. We all know that.
But replaced with something smaller.
Replaced with something smaller. Okay, but it would seem like a good thing at the time, but then you thought, no, I don't want this thing.
Well, if you look at it, when you lift it up, it's actually crooked. If you lift it, turn it, it's kind of crooked.
Yeah.
It's on an angle.
There you go. So we're going to remove that for you. There you go, Dr. Mulholland.
And so this is one of the neatest things that you ever see on TV. There's a tattoo, and in about 15 seconds, it'll be gone.
All right.
Okay? So we simply line up our tattoo, which is set on black. And
It's gone! Are you kidding me?
Is that not the most amazing?
How many times do you have to get this done?
She might have to come in 3 times.
Oh my God, I'm freaking out right now.
Does it hurt? No. We've got a little bit of local freezing, and so it doesn't hurt. And
bye-bye tattoo.
And that's it.
There you go. And if somebody does have initials or the name of somebody that they were in love with and they're no longer with them, it's as easy to do. I know you're still with your husband. You love him, but...
when Bob becomes Dave, Dave and Bob can say goodbye to each other.
You don't have to kind of turn Bob into Dave, or you don't have to go out and find another Bob. You could actually just get it removed.
Right.
All right.
The other thing is that now that's black. We have different hand pieces, yellow, orange, red, green. We pluck them on, and the multicolors are gone as well.
Boom, like that, here at SpaMedica. Thank you so much. Continuing when we come back, taking a break from breakfast television. See you in a bit. It's gone. Just a couple.
These are of tattoos, and tattoos are very common. Patients will come in and they want to change one name to another if they end a relationship, or they want to get rid of pattern tattoos, or sadly they want to remove the tattoo to put another one over that area. And so tattoo removal is a very, very common laser treatment we do here.
Okay, can you really get rid of this tattoo completely, where you can't even tell that you had a tattoo?
Well, as you can see, some colors do very well. The blacks and the greens do extremely well. Once you have yellow and robin's eggs blue, there's a little yellow in this tattoo and blue, it gets a little more difficult. But generally, after 10 treatments, you can get 80–90% reduction. It usually costs you far more to get it on than it does to get it off than it does to get it on.
Dr. Mulholland? Just when you're flashing? Okay, I'll put them on now. We are here with Dr. Stephen Mulholland at SpaMedica, and we were talking about the tattoo removal. Now, I know a lot of people are interested in this because a lot of people out there have tattoos that they might not want anymore. Now, Jen, first of all, tell me about your tattoo. When did you get this?
I think I was about 15.
And what were you thinking?
I wasn't thinking. That was the problem.
Well, you know, you're young and you were with one of your best friends and you both decided to get the same tattoo.
Yes.
And then you thought, well, I'll change it and I'll add to it. So you added to it.
Of course, yep.
And now why don't you want it anymore?
Because it's just not classy. I can't cover it up and I can't really wear anything, so it limits my wardrobe very much.
Okay, Dr. Mulholland, what can we do for her?
What we're doing right now, Jennifer, is a little laser that's designed specifically for tattoos. And you can hear a loud pop, but she's in no pain at all. It takes no topical anesthetic, and it provides, it shatters the pigment, basically provides a little photoacoustic wave that shatters the pigment. In about 3 days, about 20% of her pigment of her tattoo will just wash off.
Wow! Now, she's already had 2 treatments done.
She has, yeah.
Okay, is it going to be back to the original skin, or will you always see something there?
You know, it used to be in the older lasers, there was kind of a ghostly white thing.
Yeah.
But now with our modern laser approach, we can really fade the tattoo to make it look virtually like your surrounding skin used to be. And so it takes hours to get on it. It takes me only a few minutes here to treat it and get it off.
Hey.
She'll wear a little Band-Aid, a little polysporin, and she'll be done.
Okay, again, I have to ask you the cost because people think that this is extremely expensive.
You know, it isn't. It's usually under $1,000 a treatment, and you usually need 500 to 700 a treatment. You usually need about 5 to 7 treatments to get the removal that you want.
Okay.
That's it. We're done.
And you know what? It's worth it if you don't want that tattoo anymore.